Dr. Zhao. Next presenter is Dr. Yi. Dr. Yi has done a successful job in Malawi. Surprisingly, he just told me that because his reputation, the hospital's good job in Africa, he managed to make connection with the Bill Gates Foundation in the United States. So that is why today I invite him to show how the hospital has done in the country of Malawi. Thank you.
Thank you for the kind introduction, and Your Excellencies, Ministers, Honorable Chairman, and also all our honorable guests in the floor. So I would like to have a very brief introduction about the health information system. What we say is the HIS, Strengthening and Development Program in Malawi. This is the context. I would like to say this is about a landlocked country, about 18 million people, and the GDP is around $400-something US per year, and human development index is in the lower rank of the globe. But the life expectancy is improving. At the time, during my 5-year stay in Malawi, the life expectancy is around 45 years old. But now it's improving due to the improving of the infant mortality. This is very crucial. The HIV/AIDS prevalence is similar the same, but the life expectancy is improving a lot due to the decreased number of mortality in the children. This is very important. So consider this is a low-income countries. And also we can see the Malawi health system. This is a national health system and divided into 3 regions and categorized into 5 zones according to the administration, decentralization of the health system. And also we can see we have the 29 health districts with 28 administrative districts, including one is the capital areas. So this is the most of the health systems are decentralized through the WHO. And this is the Malawi health system is concerning the public sector and also including the private sectors. And also 36% for MPOs facilitate under the government regulation. And also we can see that the healthcare system, service system is a hierarchy system, including from the bottom of the health system is from the community basis and then to the facility level. And so this is the context of the health information system development in Malawi. So under the supervisor of the Ministry of Health and Population, and also this is the, as I mentioned before, is the district health officer and hospitals, health centers, and also the private sectors. So the backbone is the community health workers. So this is very important for the architectures and the application standard of the HIS system in the countries. And you can see that this is in the facility level or the backbone levels, as I mentioned before. So a lot of the support of the data, indeed the quality of data usually mostly collect from these lower levels. But when it's improving, trying to what we call the aggregated data into a higher level, to the district or national level, you can see that there's a lot of loss of the quantity of the data. So I think this is what we are concerned about, the data collection, whether it can be used or applicable to the community or to the nations. So, and also we can find a lot of lists indeed from the national level or global level. So the information tools, this is individual level data, and or we can aggregate those individual data to the higher levels of the district or national level. I think this is the crucial issue that we need to think about. So at the moment we can see that a lot of the application is how to aggregate the data from the individual level or facility level to the higher district level or national level. So at the moment the most popular one in the African country is using the DHIS is organized, is established by the University of Oslo in Norway. This is our partners working together for that development. So our objective of the Look International, this is the Norwegian-based organization, has been working with us for more than 20 years, and then our main target is to restore human health and dignity. And our overall objective in the areas of HIS development is trying to develop a sustainable and local owned and with local empowerment health system. We are not going to adopt the foreign system into the local system. We are trying to empower them to consolidate the health system in the country. And we train the local professional in the competence of management of the information technologies. So this is our development strategy, including the long-term commitment and support by the hospitals, and also we have the human resources support from Norway, Taiwan, and Malawi. And also we try to cultivating the local capacity for sustainability, including the resources, technologies, and also researchers or academic basis. And also we are working with professional, multidisciplinary or cross-paradigm together based on the actor network theory. This is important because when we say actors, it means this is the data generator. But usually the data they generate the data, they did not use the data. We try to generate the data and also to use the data too. This is important. And also we have the participatory design and we have the smart development strategy for information things. So this is important. So our belief working together with people based on mutual respect and understanding. So the fieldwork, I would like to have a few minutes concerned about the fieldwork result. From the top, from the bottom level, community level supporting line. This is funded by the EU research project for 3 years. So it's finished last year and we are targeting on the mother and child sickness. And also the field community child study is using the M-Health. So this is our GPS location that we're trying to collecting the information through the development of Malawi integrated community health system in the community area, in the rural area. I think this is the way we are using, we are coverage areas, including the best, the participants, and all this information has been reported to the EU's communities. So this is important that we are trying to do the preliminary trial result. And then the next is about another support from the UNICEF fund pilot projects based on the WHO solution for the disease surveillance. And through this, we are trying to find out some, because there's, for example, a lot of the disease outbreak or spot outbreak, we're trying to allocate the resources. Where is the outbreak areas? So through this surveillance system, we are using the mobile solution, and also we can aggregate those data in the rural areas. For example, the fever, some outbreak of the fever cases. And last year, we have make an outbreak surveillance for the cholera in the northern region of Malawi. So this is very important that they know that there's some outbreak in the areas with fever, diarrhea, and then they can say it may be there's some happen for the cholera cases. So disease surveillance system is important through the support of this. So we try to integrate of disease surveillance and response system in the areas. And then on the patient level, we support by the PEFA and working with the local NGO Biobot Trust. So at the moment we have installed and facilitated more than 170 health facilities in the area. Our impact is to ongoing development, is still ongoing, and we are trying to improve the quality of care as a goal of the Ministry of Health in Malawi. So we train the peoples on job trainings, and we using the PACE together. You can see that this is the only system have been yet implemented in the Malawi's public health system facility. The picture archiving communicating system, so they can review the X-ray not using the physical film. They can use this is very common in the Western world or in Taiwan, but this is new in the area. So through this, they can decrease the cost for the finishing of the films, and also this is another support for facility level comprehensive HIS. We are working with the Ministry of Health and also one of the central hospital. This is the patient flow that we developed through our volunteer from Taiwan National University, and they support us through this patient flow. We can improve the quality of goal and organization change and behavior and social change. So this is what we are doing now at the facility level. And then cooperate with the University of Oslo through this district health information system, that's version 2. So we are able to aggregate those data collect from the ground level, including the community level and also the facility level to the regional and national health level. And then the final one is about the national level. So this is what we have done yet. For example, the high temperature person and also the diarrhea. So we try to use this as support by the World Bank for Ebola emergency response. We use our development in integrate disease surveillance response system. So and now we are able to set up all the surveillance sentinel surveillance point in Malawi. And the final is about the clinical project is supported by the Bill and Melinda Gates Foundation. So we are trying to adding data for action. So collect the data in the community and using the dashboard for the decision makers that which parts of the areas they are lacking of the resources, especially we use this in the HIV/AIDS case follow-up. And also this is national level. We are also working together as a task force member in his policy strategy plan, e-health strategy plan, digital health strategy plan, and also the community health strategy plan. So we are the core member of that national level. The challenge, we have lacking of the infrastructure, a lot of the resources constraints, a lot of brain strains, and also the complicated social interaction. But we know that we have the further developments. We know that we need to work together to get the strengthening and embed all the action design research and including the implementation research together. And also we need to cultivate human resources, international exposure, and also using the local resources, international resources. We try to recreating animals environment for innovating his development, even though this is a low resources limiting country. Thank you for your attention.
Thank you, Dr. Yi, for your wonderful presentation. Our